Study for the MCAT anytime, anywhere, and boost your score. Get started with the MCAT Prep app by Med School Coach. Access hundreds of video tutorials, flashcards, and a robust question bank. With study scheduling and spaced repetition flashcards, mastering the MCAT has never been easier or more convenient. Join thousands of satisfied users who have elevated their MCAT game. Download the MCAT Prep app by Med School Coach from your favorite app store today.
One of the first sort of outbreak responses I worked on was the Ebola response, not in Africa, but we had a domestic case in the US. And so within a few hours of getting like a positive test result at CDC, we were on a plane to Texas. And I remember calling my husband and saying, like, I'm about to get on this plane. I'm about to go do this. And he's like, okay, but when are you coming back? And I'm like, I have no idea. Like, we had one way to.
Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Join us weekly for stories and insights to empower pre-med and medical students to pursue their aspirations of becoming doctors. Hear from physicians, deans, advisors, and industry experts on becoming a standout candidate and what life is truly like in the medical field. Let passion ignite your journey toward residency and becoming a doctor.
Clinical work does not have to be the final destination with studying medicine. It can be, but it can also open doors to undiscovered passions. Today's guest exemplifies the abundant career opportunities afforded to medical students. Dr. Charnetta Williams is a distinguished OBGYN and a medical epidemiologist. She splits her time between clinical work and public health. Dr. Williams knew from the age of 10 that she wanted to practice obstetrics. However, a pivotal session on public health at the ACOG conference reshaped her trajectory, revealing a latent passion for public health. Through a CDC Fellowship, she built her desired career with one foot in clinical medicine and the other in the public sector. Our conversation delves into the nuances of work-life balance, the profound impact of representation in medicine, and the indispensable support networks required for women navigating the postpartum period. Here's my conversation with Dr. Williams.
You also mentioned that you're working in epidemiology, and we know, like, since the pandemic has started, that it's a really important field. Like, it's always been very important, but it's been even more highlighted. So you've had quite a career where you've been full-time clinical, and then you kind of moved into public health, and now you're doing kind of a mix. I just want to know, like, how have you been able to navigate creating the career that you desire and doing a mix of different things?
You know, as I mentioned, I was hooked on obstetrics and gynecology since I was 10. And so that was always a dream of mine. And so when I went into medical school, I knew that's what I was going to do. My OB rotation didn't really go that well, to be honest. But I was still like, nope, this is what I'm doing. I love this. And so when I got into residency, I was like, okay, I love the obstetrics part of this. I didn't love the GYN surgery part quite as much. Like, I really wanted to just focus on delivering babies. I did not enjoy these long surgeries, removing fibroids. I was like, oh my gosh, this is not what I wanted to do. So I think I started getting a little bit of that feeling like, oh, there must be more, or this is not quite it, when I was in residency. But, you know, once you have completed, undergraduate and medical school, and I did a post-bac, all these things, it's sort of like you feel like I'm sort of committed here. I can't really just say, oh, I want to go. I considered, I just want to be a secretary somewhere. Like, I just want to, like, I'll work at Starbucks. But then I also felt like I don't even know how to do those things. It's weird. Like, you have all this training, but like, that's all I knew how to do. So I'm like, okay, what am I going to do? I'm kind of committed. So once I finished, my medical school training, and I got into an OB residency and finished that out, I ended up staying on where I trained as an attending for about 2 years. And that was a grueling 2 years for me. I was like, it was a little bit of a challenge because I was working alongside my attendings, right? I used to be their resident. Now I'm their colleague, but I wasn't always treated that way. Like, I got the worst call schedule. It was like, until I finally said something. I also was the prison doc as well, right? We had a high risk OB clinic in this like maximum security federal prison in New York. and nobody else wanted to do it. So guess who had to do it? It was me. Right. And honestly, it was a great experience. Like I had some really good outcomes with the patients I took care of there. And it was actually a very nice experience. But again, I had to do these extra things that nobody wanted to do. And like I said, I started getting the feeling like this is not it. So in my mind, I said, I would love to have a career where I work on sort of like national health initiatives, but still have like my foot in sort of the clinical door as well. But I did not know that sort of career existed, right? Like I was like, this is just something in my head. Until one year, I was preparing to go to an OBGYN conference, like the American College of Obstetricians and Gynecologists. They have an annual clinical meeting. And so I used to go to the meeting every year. And so I was planning on going to the meeting and saw that they had a session called something like public health and the OBGYN. And I was like, wow, that's interesting. Because I did always have an interest in public health, even going back to like undergraduate. But I was like, I just have to focus on, getting into med school. I don't really have time for this. But it always was in the back of my mind. So when I saw that on the agenda, I said, oh, this is a session I need to attend. The problem was you had to pre-register for that session and it was full. So I was like, wow. So on the day of that session, I said, you know what? I'm just going to go and I'm just going to sit there and hopefully no one kicks me out. Right. So I go because it was like a round table. It was like 10 seats. There was like, and I'm like, it's going to be quite obvious if I'm sitting it. But anyway, I went and I said, there's an open seat. I'm just going to sit down. And I really hope the person doesn't show up. And they didn't show up. So anyway, so I went there and there were two OBGYNs from the Centers for Disease Control and Prevention, or CDC. And they were talking about their careers there. And I had no idea that was even an option for me. When I thought about CDC, I'm thinking, oh, it's a bunch of like infectious disease docs, epis. Like I had no idea as an OBGYN, I could work at the CDC. So they introduced a fellowship that CDC has. There's a 2-year fellowship in applied epidemiology called the Epidemic Intelligence Service. So that's how I ended up kind of making that switch. I applied and I got in, and the rest is history. I mean, it was definitely a big decision because, like a lot of us, I had a ton of student loans. I had a full scholarship to medical school, but I still had a ton of student loans, right? And, I was leaving my full-time OBGYN attending salary to become a fellow again. So it was a tough decision in that respect, but I was like, no, this is what I'm doing. Like, I just felt like this is what I should be doing.
I love the transparency in your story because I feel as though a lot of people may get to that point where you get to that 5, that 10, that 15-year itch in medicine. And you're like, okay, I like this. Like, this is my life goal, but what else is there? Like, and sometimes we can think about different things. I remember when I was maybe an intern, and, those years are hard. And you're sitting there, you're talking with your friends and your colleagues, and you're like, I don't know. I don't even have any skills. Like, I've only done medicine this whole time. Like, I can barely even, probably get a job at Sephora. Number one, that's not true. But there are so many things that you can do with your medical degree because your skills are transferable. So you have been learning how to lead teams. You have been learning how to communicate well and effectively and present complex data through presentations. And these are different things that can translate well into other industries, whether or not it's in public health, which of course we can work in public health. Like, we're physicians, this is what we do. Of course, we may need a little more training in the data and the numbers and things, but you're capable of learning these things. But there are also other realms where people can work in, whether or not it's pharmaceuticals or even stuff outside of medicine, like entrepreneurship. So never feel like you are stuck, but it's also a great thing that you mentioned you were bold and you went to that conference. You were like, this is for me. I mean, if they want to tell me, I can sit on the floor. So you asked questions and you were able to figure out that other people in your field were already doing this, and you were able to navigate that path to do something else. And yes, it was scary because you're going back on that attending salary to being a fellow. You may move, all of the different things, but it's about kind of the components of your life and your journey through medicine that have been kind of altered through that one experience.
Absolutely. And I would encourage anyone, if you're even thinking about it, take a chance on yourself. I think the biggest lesson I've learned throughout this whole journey is that medicine is not the final destination, right? Like for my whole life, I felt like that was it. Like once I got there, that was it. And now I'm realizing like medicine is literally a door, right? Like it opens the door to so many things, like so many opportunities, like you said. I mean, the fact that, we're speaking to an audience of like medical students and residents, the fact that you've gotten that far alone tells me a lot, right? Like we have the capacity to learn new things, to learn really complex things. That's who we are, right? We're problem solvers by nature. So I feel like medicine is not the final destination. It doesn't have to be. I mean, if you want it to be, that's fine. But medicine really can be a door. It opens so many doors. And I'm learning this more and more every day.
Absolutely.
And I would say too, like the experiences that I had. So sort of a funny story. So I moved from clinical medicine full-time to public health full-time back in 2014. And I had just gotten married that year as well. And I told my husband, I was like, oh, because he was with me throughout my whole training. And I said, we're moving to Atlanta. We moved from New York to Atlanta. And I said, I'm not going to be on call as much and I'm going to have much more free time, right? But 2014 was also the year that Ebola hit. Right. So when I moved that year and Ebola hit, I had just started my Epi Fellowship at CDC. So maybe like 2 months prior. And so one of the first sort of outbreak responses I worked on was the Ebola response, not in Africa, but we had a domestic case in the US. And so within a few hours of getting like a positive test result at CDC, we were on a plane to Texas. And I remember calling my husband and saying like, I'm about to get on this plane. I'm about to go do this. And he's like, okay, but when are you coming back? And I'm like, I have no idea. Like we had one-way tickets and I didn't come home for another month, right? So I went from like, oh yeah, I'm going to have all this time and all this stuff to this. And, we've had I've worked on so many other responses since then as well that, I think people now start to have a better understanding of sort of public health infrastructure and what we do and sort of like we're invisible, right? Until like there's a problem.
Mm-hmm.
Yeah, I had no idea about what goes on in the background. Now I have much better understanding of this. But yeah, so it wasn't like, oh, I'm just going to be home. No, it's not that either. But I also do feel like I have more control over my day-to-day life, more than I had when I was working full-time in the hospital. And, I was in the hospital 24 hours plus, when I was on call. So yeah, I do like that part of this a lot better. And I've had the most amazing experiences. Like, I don't know. Besides the ones at CDC, I really don't know other OBGYNs who've worked on Ebola and COVID and Zika, like the way, that I have. So really the best experiences based on just a chance I took, right, at that OBGYN conference that day.
I love that. And I love that you mentioned that because a lot of times, especially during these times when you think of epidemiology and you're thinking of COVID, you're thinking of coronavirus and all of the different things. But when you think back, there are so many different things that you can learn and you can be a part of, like the HIV pandemic, like you said, Zika, we had monkeypox. There are so many things that are always coming through where you'll be able to use your skill sets as well as trying to just kind of help humanity, like that helping people portion, which is typically the why that we have when we're applying to medical school. Other things people can also think about. I think, like you mentioned, there's extra training. So people who are going into OBGYN, like you said, may have never imagined that they could impact the world in this manner. But there are also other specialties where it may be even more applied, like infectious disease and things. So when you're thinking about what residency you're going into, you may want to also think about these things, as well as I think sometimes you can even do the rotations or fellowships when you're a student. So it can give you that exposure to see if it is a path that you want to choose and go down, because who knows, maybe you may want to be like the director of health department or something like that. And they have all of these different roles that come out. So it is definitely a career to explore.
Absolutely. Whether you have a DO or an MD behind your name, I think it opens more doors for you, right? Those opportunities are going to be more readily available to you. And I would like to say, like if anyone out there who's listening, if you're even remotely interested in public health, CDC does have fellowship programs that are available to medical students. So you can get, like, for example, I'm going to have a fellow in a few weeks, fourth year medical student who's going to rotate with me and do a host of things. So, there are opportunities out there. You just have to be open to them. You have to seek them out.
I think some of that also comes for the students who are listening in terms of planning. So when you're planning your rotations and when you're looking on the website, for instance, like the CDC or other programs that may be out there, planning your year, because you may have a little more flexibility in your fourth year to say like, okay, I want to go and do this fellowship or this type of thing, or I want this role in the future. How can I supplement my application, or how can I just get more exposure and have the time to do that? So it's definitely something you could probably talk about maybe in your third year so that you can plan things out.
Absolutely. Yeah. We hosted a fellow last year too. Yeah. It seems to be a little bit easier for, like, third and fourth year students, but yeah, definitely something to consider. And I think also it would help your interviews, right? If you have this to talk about, your applications, these are unique experiences that not everyone has a chance to have. So.
In the competitive world of medical school, your application is the first look advisors have into what makes you shine. But where do you start? Luckily, Med School Coach has the expertise to elevate your application to the next level. From crafting a compelling personal statement to developing a narrative for your secondary essays, we know what admissions committees are looking for, and we're here to help you develop your authentic voice. Visit medschoolcoach.com for more on application support.
Now, you mentioned a little bit about it when you were talking about your experience when you first started at the CDC. And you also mentioned that you're a mom and a wife and all the things, that you're still working clinically. So a lot of students and residents and even attending struggle with work-life balance. What advice do you have for them?
Yeah, this is a good one and it's hard to do because I think about when I was a medical student, even a resident, well, really when I was a medical student, really trying to think about what sort of residency. I mean, I kind of knew I was going to go into obstetrics and gynecology, but I did not think about how I want my life to be, right? It was all about my career. And I figured the life would just happen around my career. And I think more students need to spend more time thinking about their life and how their career will fit into their lives, not the other way around. Like, for example, the first day of my general surgery rotation, I remember the attending took us in his office. And the first thing he said to us was, "I have not left the hospital in 3 days." And right there, I knew I am not going into right, like that. I knew like that was not for me. And so these are the things that we do need to consider, like, do you enjoy going home every day? Do you enjoy spending time in the hospital for long periods of time? Some people do enjoy that. And so you have to think about like how that will impact your life. And it's hard to do. It's hard to think about that when you don't have children or you don't have a partner yet that you have to consider, but you do have to think about how that might impact things should you have a partner later in life, should you decide to start a family. All of these things play a role. And I wish I had better advice, but all I could say is that you have to kind of keep that in the back of your mind, because your life, you are more than just your career. You are more than just a physician. There's a whole life you're building. And that has to be, I think, at the forefront. And then your career second, because you're important. If you're not happy and with where you are in life, like, you're not going to be the best at your career. You're not going to be the best at delivering care to your patients either, right?
Absolutely. Like, you are so much more than being a doctor. Like, that's a component of who you are. It does not define who you are. So that's why you need to have hobbies. You need to have things outside of medicine. You need to have people outside of medicine in your life so that you can live a life. So it's so important to figure out, like, that's why we have the rotations in the third and fourth year, so that you can have that exposure. And yes, it may be exciting for those 4 to 8 weeks where you're there. You're like, oh my goodness, I love using this and all.
Right.
For 30 years, we standing up there, can't go to the bathroom. I mean, I know, no shade, y'all are surgeons out there.
Right.
We need you. But Erkeda could not be sitting there like,
and that was me.
So know yourself.
That was me too. I did not enjoy those really, 6, 7 hour surgery. I did not enjoy that. So, and I just thought about something that perhaps, students or residents could ask your attendings, like ask them questions about their life. Like, what is your day-to-day life like? What time do you come into the hospital? What time do you leave? How often are you on call? What does your partner, think about this? These are great questions to ask. I know I definitely didn't ask these questions. But I wish I did.
And honestly, I love that suggestion because people love talking about themselves. So most of the time people will answer like, don't kind of cross the line and ask creepy questions. But I think about lifestyle because it's so important.
It's really, really important. I think we really need to spend more time on that, right? Because this is your life. This is something you're going to be doing for many, many years. You want to make sure that it fits, I'm not saying that any job is going to be totally perfect, but you want to make sure that you're happy with your decision, right?
Absolutely. So we just talked about how you're doing all the things, but on top of that, you're also an author. Can you tell us about your book?
Yes. So I am a new children's book author, and this is something that I'm really proud of and something that I never could have imagined doing when I was, thinking about a career. Like becoming an author was nowhere on the radar. I think having children changed that a bit. I became a mom for the first time 5 years ago. And as a woman of color, I was trying to be very intentional about finding children's books that highlighted children of color, not just as like the sidekick, but as the main character. And I found that that was a little challenging. And then when I did find books that highlighted, characters of color as the main character, they were often about like our hair and skin, which we have those books in my house, like we do. But I'm like, we're more than that. Like our skin and hair are beautiful. I agree. But like I wanted some other life lessons in there as well. And I found like there weren't that many. And actually I read a study. There was an analysis done. Well, I think they do it every year, and I can't remember the last time I looked at it. It was probably 2 years ago. But I was like shocked by this. They said that there were more children's books that highlighted main characters that were animals, that had main characters like was a child of color. And I was like, oh my gosh, what? So I decided, well, I could complain about it and say, oh, I can't find books, or I could just be part of the solution. And so I decided to do that. So my debut book is entitled Penelope and the Power of Positivity. And it's sort of the main character. Her name is Penelope. She's sort of a conglomerate of myself, my daughter, and my mother, all wrapped into one. But really, it's a story about myself, I would say. Just about like dealing with a lot of like the negative thoughts I had in my head throughout my training, like self-doubt and fear that I feel like a lot of medical students probably deal with. As hard as we work and, we do well in school, we get the good grades, but there's always this like, am I good enough? Is this what I'm supposed to be doing? And so in the story, Penelope wants to become a doctor, but her two best friends named Fear and Self-Doubt say, you know what, that's too big of a dream and that's too scary of a dream. So we don't think that's for you. And so it's all about how she overcomes these two to accomplish her goals. In the book, she decides I need to find new friends, and she runs into someone named Positivity, and Positivity introduces her to hope, determination, hard work, all these other people that she's like, oh, okay, I can do this. And she does it. So really proud of that book. I mean, as proud as I am of becoming a doctor, the pathway to becoming a doctor, like those steps are laid out for us, right? Like we know you learn quickly. I have to get my undergraduate degree, then I go to medical school, then I do residency, and then maybe I do a fellowship. But the pathway to becoming an author, there are no steps laid out for you. So I feel like I'm just super proud of it because it's something that's in my head, and now it's something I hold in my hand, and I'm like, I had to figure that out on my own, how to make that happen.
I absolutely love that. Number one, it's such a universal story where so many people, no matter where you are, even if you're doing fabulously and you're like, I got this in the bag, there's going to be one part in your medical journey where you are not going to be the best. Whether or not that's your bedside manner, whether or not that's you doing your exams, whether or not that's you as an attending having an issue, falling into a malpractice, whatever it may be, you're not going to do 100% the best every time. So it's great that you're talking about like the self-doubt and all of that and how to overcome it. And then I also love that you are talking about representation because even in medicine, we see it where about 5% of doctors are African American, about 5% are Latin, and then even less than that are indigenous. So we have to have that representation all out. And yes, we can have allies. So no matter what background you come, you probably should buy this book for your child or yourself. But we are seeing that even like in Marvel and things, like representation is important, and it can definitely encourage other people, especially children, to see themselves in their future and see things like, I want to be a doctor too.
Absolutely. I think it's so important for children to see people who look like them in roles that they might be interested in, right? Like we all need that vision board in our lives, right? So that was my goal, just to create that. And, like you said, the book is not just for people of color. The story features a little girl, a brown girl, but the story is universal, right? Like no matter what field you go into, medicine, whatever, we all deal with these feelings of like self-doubt and fear. And so this is just a reminder that, we may not be able to completely get rid of them, but we don't have to listen to them, right?
Absolutely. Yeah. And as you mentioned, like the vision board of that. So I love to ask my guests as we're closing up, like you've been such a great guest, but we all know that the healthcare system could use a little bit of a magic wand or like oomph or something. So if there was something that you could change about the US healthcare system, what would it be?
I think one thing that I would change. So when I thought about becoming an OBGYN, underlying all of that was just my desire to help women, right? Like I really wanted to be able to support women, particularly during their reproductive years and through their transition from pregnancy and in the postpartum period. And so I definitely feel like we need to do more as a healthcare system to support women in the postpartum period. So much of the pregnancy it's focused on this little baby that we're growing, right? Which is, we need to have that focus too, but the woman herself goes through such a transition. And I feel like, coming to see your provider one time and during that 6 weeks and then you're off, it's just not enough. And as someone who has been through it twice myself, I've had 2 very difficult postpartum journeys. I'm like, wow, I had no idea. Medical school didn't prepare me for that. Residency certainly didn't prepare me for that. When I think about the patients I used to care for before I had children, I'm like, oh my gosh, like I had no idea they were going through all of this. And we just, the way the current system is set up, I don't feel like doctors can spend that time with the patients to really understand this. And I read a study recently, it was saying that most mothers, new mothers, don't feel like they get adequate support at the 6-week postpartum visit. And not only that, but I thought this was very interesting. A lot of women feel like they want mothering advice, right? Not just medical advice, mothering advice, but they don't want it from because we all get mothering advice. Like if anyone who's been pregnant, you're going to get a ton of advice from your friends, your mom, your aunt, people in the grocery store, you'll get it. But in this study, women wanted advice from medical providers, but mothering advice. And I'm like, what a gift to be a woman providing care for women and to be able to give mothering advice. But you can only do that if you have the time, right? So that is something that I'm also working on. It's in the works, but I'm working with a colleague of mine. She's a pediatrician. So we're joining forces to create something that will support women in the postpartum period. Something, we're not calling it healthcare. So it kind of answers your question, but we're not calling it healthcare, nor are we saying we're, giving medical advice, but we want to fill the gap in some way. So
I love that. Like education and support is so necessary. And if they aren't getting it from us, as we've seen with all of the misinformation on social media and things, we have to meet patients where they are. And then we have to give them reputable information from people who are educated and trained and just want to help. So I appreciate you guys for embarking on that journey. And once your things come together, you'll have to come back and tell us about it.
Oh, absolutely. I would love to.
So I really appreciate you for taking the time to join us on this episode. I want to give you an opportunity to tell everyone goodbye, as well as let them know where to find you, where to find your book, and all the things.
So I always say this, like if anybody's interested in public health or, even thinking about it, I am happy to chat with anyone. I can be found on social media at Picture Perfect Reads. That's where you can find sort of my author journey. My website is pictureperfectreads.com, but feel free to reach out about, anything there. And then you can definitely find my book and all the other goodies I have there as well.
If you like this episode, please share it and make sure to subscribe anywhere you get your podcasts. You can also find me, Dr. Erkeda DeRouen, on Instagram at Dr. DGram, DOCTOR, the letter DGRAM, or on LinkedIn under my name, Erkeda DeRouen. See you guys next week.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.
Are you ready to conquer the MCAT and secure your future in medicine? Look no further than Med School Coach. With our unparalleled expertise and cutting-edge resources, you'll tackle the MCAT with confidence. Our practice exams, crafted by the world's leading MCAT experts, provide the most realistic simulation available. Discover your strengths and weaknesses with in-depth analytics and detailed explanations for every question. Plus, with options like our free half-length exam and affordable bundles, mastering the MCAT has never been easier or more accessible. Don't just prepare for the MCAT. Excel with Med School Coach.